All right. Hi, everybody. Dr. Rayford here at Triage. It's a bit late tonight for our live stream, but that's okay. August 12th, 8:53 p.m. Pacific time. And we're going to talk about whether or not you can use drugs for people on animals. This is specifically for either prescription drugs for people or over-the-counter drugs for people. We're not talking about like recreational, but although you kind of can with CBD type products, because plenty of people use those for animals these days. But anyway, we'll focus on prescription drugs and over the counter. Also, this won't be a discussion regarding like specific drugs because there's a lot of them, and it all depends on your pet what you're going to use. But there'll be a general discussion on this topic. So first off, the easy answer is yes, you can use human drugs. There's a few things to be weary of. First of all, these drugs for people are sometimes used in veterinary medicine. Oftentimes, the veterinary drugs were taken from those of human medicine. There are some specific drugs that are unique to veterinary medicine that they don't use in people, but a lot of the drugs we take from people. In fact, before a drug can even be put on the market, it has to go through extensive clinical trials, and animals are the majority of the clinical trials. Starts off like in a lab, and then rodents, and then usually dogs or some other related mammal, and then non-human primates, and then humans. So those are the clinical trials to get, like, I think FDA approval. Anyway, you want to make sure that so most human drugs are used in veterinary medicine, but the majority are not used in veterinary medicine, right? So the majority of veterinary drugs are from the human side. The majority of human drugs are not going to go to veterinary medicine side. So you have to first make sure that the drug that we're going to use in an animal was actually reportedly used in animals to begin with. There are online resources for that that are usually accessible only to professionals. So if you're a pet owner doing that kind of research, you're risking getting a bunch of information from unprofessional or non-licensed people, social media, etc. So be careful of that. And of course, the other resource, which is the ideal, is a veterinarian should be able to tell you or be able to look up the resources to tell you whether or not a drug can be used. The veterinarian is not going to know every single human drug in the world. There's no way. But a specific drug, they can look it up and see it's ever been reportedly used in that animal, and then determine whether or not it is safe, yes or no. Is it efficacious, yes or no? What's the dosing? What's the frequency? How long can you use it for? Then on the over-the-counter side of things, there are many video calls in Vet Triage where a client was trying to do some good, looked up a dose of whatever from online. It was the wrong dose, or they calculated it wrong, or whatever. And now they're calling Vet Triage because they've now accidentally overdosed or incorrectly gave a dog or cat or whatever the incorrect medication. So even over-the-counter stuff, even though it's over-the-counter and doesn't require a prescription, you need to make sure that a veterinarian is helping you direct that initiative to make sure that that drug is safe and efficacious, and what the appropriate dose, frequency, and duration are going to be. So just because Benadryl, for example, is over-the-counter doesn't mean you can just give it willy-nilly. You can overdo it. And there's certain formulations you should be aware of, so vets can help you with that. The other part of this to be wary of are certain drugs are made more palatable for people by adding additives to it. Most notoriously, artificial sweeteners like xylitol, XYLITOL. That's the artificial sweetener found in a lot of like sugar-free gum. It's toxic for dogs, badly so, causes liver issues and low blood sugar. And you want to make sure that the medication you're using, if it comes from a human pharmacy, does not contain additives that are dangerous for animals, like xylitol. So we need to be wary of that. And this also includes over-the-counter stuff as well. Nutraceuticals, cough suppressants. These can have artificial sweeteners in them. So you need to be wary of that. things that are topical. So the human beings, we tend to have pretty, consistent skin thickness. Obviously depends on how much fat you have, what size of person you are, how old you are, your gender, all that stuff. But in general, the difference between humans in terms of their skin thickness is, going to be pretty comparable, which means that if you give a drug to a human that's over the skin, there's a better chance it's going to be absorbed and enter the body's at a plasma concentration that's going to be efficacious for the person. In animals, because different dogs, for example, have way different skin thicknesses, you cannot always rely on transdermal administration because, a Shar-Pei may not absorb that drug the same way an Italian Greyhound would. And so you have to be weary about those kinds of formulations. Most commonly are things like fentanyl patches, for example, which are commonly used in people in the preoperative or postoperative period. In animals, got to be kind of careful with it because it can hit every pet differently. So that's another thing to look out for when it comes to using human drugs. And then last thing I'll say is you have to be weary of what are called idiosyncratic reactions. Idiosyncratic reactions are a reaction that the patient has to a drug that is unique to that patient. So let's say for a common example is Valium. If you give a dog Valium, there's a small percentage that, although Valium is supposed to calm their nerves and sedate them, there's a small percentage of dogs who have the complete opposite effect. They get crazy anxious and rambunctious and restless, and they go psychotic. Like it's like they're possessed. I've rarely seen it in my career, but it's a rare phenomenon. So idiosyncratic reactions are those reactions that are those side effects that are undesirable from a drug that are rarely published, not published. They're unique to that patient, what have you. And so veterinarians can't even predict what those are, but they can at least tell you that if it does happen, that's what you're seeing. Whereas if you were to give medication at home alone without the direct supervision of a veterinarian or the consultation with a veterinarian, and your dog all of a sudden goes just insane, you think you just killed your dog and all that. And so understandably so, you're going to be very, very frantic. All right. I think that's probably a good place to stop. Hopefully that helps folks out with sort of general information regarding that topic. We can always dive into more details if folks have specific questions. Thanks for those watching on the playback. And subscribe, hit like, share, do all the things. We'll be back again tomorrow. Should be earlier stream tomorrow. If there's a better day and time, or rather a better time that I should be doing these, feel free to let me know. Otherwise, I do them when I can fit them in. Thanks so much, everybody. We'll talk to you soon. Bye.